So in this paper, we discussed the topic of walking, and we used Theodore Shatsky's social practice theory to look at the way that walking integrates with everyday life. The paper is based on interviews with a number of young men from Bristol who had participated in an RCT. We had, with 150 men, we had given them digital feedback on their walking for 6 weeks. And we then interviewed some of them, and this paper is based on those interviews. Interestingly, some of these men made a clear distinction actually between what they called proper walks and what they called incidental walking. And this we kind of think echoes Shatsky's notion of integrative practices and dispersed practices. So the proper walks were when the teleoffective element of the practice, in Shatsky's terms, or the purpose, the aim, the main aim of the practice, was walking. So going for a hike, going for a walk with your girlfriend, etc. The incidental walking, or in Shatsky's terms, dispersed practice walking, was when they were maybe going shopping, going to work, being at work, activities such as that, where the purpose was something different. The purpose of shopping, the purpose of work, the purpose was going to work, and they just happened to do that practice using walking. So what the respondents told us is that the feedback made them more aware of the dispersed element of the incidental walking within their other practices. That was quite good because they hadn't been aware of it before, but becoming aware, they then valued, for the first time sometimes, valued that walking element of shopping, of going to work, of being at work, and sometimes actually promoted or enhanced that. So, for example, one man told us he used to send emails all the time to his colleagues while at work, but having seen the digital feedback of how little activity he did at work, but how every small little walk registered many steps, as a result of that, he began to walk to the next office and to other offices to see his colleagues, to talk to them, instead of sending them emails. Examples of integrative practices increasing, we also saw that. So here there's an example of a man who realized from the feedback that when walking at home, he was very, very, very inactive. And this is somewhat news for him. He also saw, though, that when he just popped to the shops during a day walking at home, how significantly that contributed towards his day's activities. So he became aware of the dispersed walking within shopping. He valued it more, but in this case, something slightly different happened as a consequence. As a consequence of this awareness, we would say, he invented a new health practice, a new walking practice, an integrative walking practice, in which shopping was a pretext. So he told us how he would then think of an excuse to go to the shops. But now, rather than the shopping being the main teleoffective element, the main purpose, the main goal, the walking was actually the main goal, the shopping was a pretext. So here is a new integrative health practice invented as a result of increased awareness of incidental dispersed walking. This, we would argue, is really interesting in terms of understanding social practices and understanding how walking integrates into everyday life. It's also potentially quite useful for the promotion of active lifestyles. We use the work of Southerton to argue how proper walks are very difficult to schedule, because if you go on a hike, if you go on a walk properly, some other activity needs to be displaced. You need to make room for it. Whereas if you simply up the dispersed walking within other activities, that's much easier to introduce as a lifestyle change. And this is what many of the men were telling us. So potentially in health promotion, if you can find ways of making people more aware of their dispersed walking, helping them value that dispersed walking more, it's less likely to fall away, it's more likely to be emphasized, more likely to be built up. In the study, we had the example of a young man who had been living in the southwest, who moved in the far southwest, had moved to Bristol, moved jobs. His new job and his new home did not involve him having to travel a long way to work, as he had previously. He hadn't been aware of the benefits, hadn't even really been aware in a way of the exercise embedded within his journey to work, and neither was he aware when he lost it. The feedback, however, increased his awareness of the value of the journey to work and the exercise embedded within that, and by making him more aware of it, it therefore ensured that he embedded more exercise within his new work journey, travel to work journey. We do have a few reservations about arising from this study. The one is that by tracking people's activity digitally, you do give them a very partial view of the practices that the walking is embedded within. So tracking the walking within shopping, the walking within work, emphasizes steps. It digitizes that particular practice. And whereas that has advantages, as we've argued, it maybe would distract attention from other elements of that practice. Thinking, for example, the benefits you gain from communing with nature while you're walking, or mindfulness, or the kind of meditative aspects of walking. If we place too much emphasis on digitizing the number of steps, you may lose some of those other benefits. You may distort people's perceptions of walking to their detriment. Nevertheless, we feel this study and this paper in particular help build up our understanding of practice theory, particularly this notion of integrative and dispersed practices, and actually suggest that understanding the type of practice can really help us understand how the interlocking nature of practices within our lives, and how we can perhaps introduce changes more easily into people's lives.